Page 1. Blood Sugar Solution, Mark Hyman, 2014. Chapter 7. Understanding the 7 Steps. I often joke that I am a holistic doctor because I take care of patients with a whole list of problems. Typically when someone has multiple complaints and they ask their doctor about them, they get told, "We can only deal with one problem at this visit." Or they get referred out to a half-dozen different specialists, one for the skin rash, one for joint pain, one for reflux, one for migraines, and so on. No one asks, how is everything connected? It's no wonder that the average Medicare patient has 6 doctors and is on 5 medications. The trick is to see the connections. When the 7 systems are out of balance, illness occurs, whether it's weight gain, diabetes, heart disease, cancer, or anything that may be on your whole list. The key is not to treat each thing separately, but to look for and treat the fundamental underlying causes. In prediabetes, diabetes, and all other diseases, imbalances, symptoms, and illness occur because of just a very few things that cause disease. The real causes of disease. In addition to single-gene genetic disorders, there are just 5 causes of all disease: poor diet, chronic stress, microbes, toxins, and allergens, all of which wash over our DNA, causing changes in our gene expression, and turning off or on different genes and messages that affect our metabolism. The 5 causes interact with the 7 key systems in the body. When those systems are out of balance, symptoms occur and doctors diagnose diseases. And there are just a few ingredients needed to make a healthy human a real, whole, fresh food: nutrients, vitamins and minerals, light, water, air, sleep, movement, rhythm, love, connection, meaning, and purpose. When you take out the bad stuff and put in the good stuff, the body knows what to do and creates health. Disease goes away as a side effect of creating health. The approach functional medicine takes to disease is not a new treatment or modality or specialty or technique. It is not integrative or alternative medicine. It is the future of medicine, applying new discoveries in biology about how we really get sick and how we can create health. It is about treating your whole system, not the symptom. It applies the most advanced science in a practical clinical method in the service of our health. It is a way of thinking that focuses on the question of why, or the cause, and not just what, or the name of the disease. The names of your diseases become irrelevant when we understand the causes. In fact, one factor can cause dozens of diseases. Take celiac disease, an allergic and autoimmune reaction to gluten. It can show up as rheumatoid arthritis, diabetes, heart disease, cancer, inflammatory bowel disease, depression, autism, osteoporosis, and more. On the other hand, one disease, such as dementia, can have many causes, including B12 deficiency, viruses, insulin resistance, and heavy metal toxicity. Imagine that you go to the doctor and say you have no energy, you feel sad, helpless, hopeless, you can't sleep, and you have no interest in food or sex. Your doctor will probably say, "Oh, I know what's wrong with you. You're depressed. You need an antidepressant." But depression is just a label we give to that collection of symptoms. It tells you nothing about what caused the symptoms. The symptoms of depression could result from an emotional trauma, an autoimmune reaction to gluten that causes low thyroid function, vitamin B12 deficiency because you are taking an acid blocker that prevents its absorption, vitamin D deficiency because you live in Seattle, inflammation in your gut from taking too many antibiotics that kill the normal flora, a high body burden of mercury because you love fish, and omega-3 deficiency because you hate fish, or insulin resistance because you eat too much sugar. the diagnosis and treatment of each of those causes is very different. The same is true for obesity and diabetes and any of the thousands of symptoms labeled as diseases in our medical books. We now have a system of classifying disease based on the location or geography in your body, heart, joint, stomach, and by symptoms. There are over 12,000 diagnoses now, and in the new classification system we will have 155,000 different diseases. This is nonsense. Functional medicine recognizes that almost all disease arises out of imbalances in the few key systems of your body, the 7 steps, that occur when you have too much of something: toxins, microbes, allergens, poor diet, stress, or not enough of something: real, whole food, nutrients, vitamins and minerals, light, water, air, sleep, movement, rhythm, love, connection, meaning, and purpose. Seeing the connections and teasing apart the real causes of disease is how I helped Evelyn. Evelyn's story: seeing connections, identifying causes. Evelyn, a 48-year-old woman, came all the way across the country from northern Canada to get help, because after seeing 12 doctors over 10 years and being diagnosed with 29 different diseases, she didn't get any answers or any better. She was over 237 pounds and had a BMI of 37. 35 is considered morbidly obese. Evelyn had a whole list of problems that we found when we looked under the hood. Rather than organizing them by disease or medical specialty, by location or symptoms, we organized them based on understanding the body as a whole system. All her symptoms were connected, but no one connected the dots. She had irritable bowel syndrome, reflux, hypertension, hypoglycemia, metabolic syndrome, obesity, hypothyroidism, polycystic ovarian syndrome, PCOS, environmental allergies, postnasal drip, latex allergy, frequent yeast infections, osteoarthritis, migraines, fibromyalgia, chronic pain, chronic fatigue syndrome, headache, migraines, frequent weight fluctuations, bulimia and anorexia, binge eating disorder, kidney stones, gout, ADD, asthma, chronic sinusitis, sleep apnea, psoriasis, depression, anxiety, infertility. What she really had were some basic imbalances caused by her diet. She was eating too much gluten, an allergen, she had too much yeast and toxic bacteria in her gut, microbes, and she had several nutritional deficiencies. This triggered systemic inflammation, leading to weight gain and prediabetes, as well as an autoimmune disease of her thyroid, which had not been diagnosed. I organized her symptoms by the 7 key systems, and then figured out what was causing the imbalances. She had hormone/metabolic/neurotransmitter imbalances, insulin resistance, prediabetes, and obesity, hypoglycemia, hypertension, frequent weight fluctuations, bulimia and anorexia, binge eating disorder, polycystic ovarian syndrome, PCOS, hypothyroidism, estrogen toxicity, irregular menstrual bleeding, premenstrual syndrome, uterine fibroids, depression and anxiety, migraines, gout, ADD, sleep apnea, infertility. She had immune, inflammatory imbalances, food allergies, chronic sinusitis and postnasal drip, environmental allergies, asthma, rosacea, psoriasis, vaginal, yeast infections, mold exposure, edema or swelling of her legs, osteoarthritis. She had digestive imbalances, irritable bowel syndrome, bloating after meals, small intestinal bacterial overgrowth, yeast overgrowth, reflux. She had detoxification imbalances, fibromyalgia, chronic fatigue, multiple chemical sensitivities, edema, high body burden of toxins and mercury, mercury amalgam fillings, kidney stones. She had energy imbalances, chronic pain, and she had nutritional imbalances, vitamin D deficiency, magnesium deficiency, zinc deficiency. I started by treating the 5 systems within which she was experiencing imbalance, not all of her 29 separate diseases. We began by simply cleaning up her diet as she started a whole foods low glycemic load diet without gluten or dairy. We cleared out the bad bugs in her gut with antibiotics and treated the yeast with antifungals. I gave her some digestive enzymes and probiotics to help normalize her gut. I then helped her get her hormones back in balance. I suspected she had a low-functioning thyroid even though doctors had told her that her tests were normal. I learned in medical school to treat the patient and not the test, so I gave her a low dose of Armour thyroid, a type of natural hormone replacement therapy. Her symptoms of premenstrual syndrome, heavy bleeding, and fibroids told me she had too much estrogen and not enough progesterone. So I gave her magnesium, vitamin B6, and hormone-balancing herbs. I also gave her support for improving her blood sugar and insulin with PGX, a superfiber, a multivitamin with extra chromium, biotin, and alpha-lipoic acid, and I prescribed a high dose of vitamin D3, 5,000 units a day because she lived in northern Canada. 6 weeks later I got her lab results back. They confirmed what I had thought, as she had very high antibodies to gluten, which triggered inflammation and an autoimmune reaction in her body, including in her thyroid gland. She had high uric acid, which causes gout and results from too much sugar and high fructose corn syrup. 1 This is a classic sign of insulin resistance and prediabetes. Her blood tests showed very high insulin and blood sugar 2 hours after a sugar drink, and her sex hormones were out of balance. And she had very low vitamin D of 16 nanograms/dl. At our 6-week phone call, she told me she was doing great. I went down the list of symptoms expecting some ongoing issues, but after struggling for 10 years, she had no more symptoms. None. No more fibromyalgia, chronic fatigue syndrome, brain fog, or depression, no more sinus problems or congestion, no more irritable bowel or reflux, no more migraines, no more PMS, heavy bleeding, or feeling tired and cold all the time. Even her psoriasis and rosacea had gone away. And as a nice side effect, she lost 21 pounds without even trying. The same things that make you sick make you fat. So when you addressed the underlying causes of disease, the weight loss is automatic. Not all of my patients have a list as long as Evelyn's, but the approach is the same: focus on identifying and treating the underlying causes of disease and helping the body's systems, and the disease, and weight loss, takes care of itself. Discovering your imbalances, personalizing the blood sugar solution. In each chapter in Part 2, I provide quizzes to help you identify which systems in your body are out of balance. Is it your hormones, your gut, Your immune system? Are you toxic? Which system is causing you the most problems? These quizzes are based on 3 factors. 1. Decades of clinical experience and testing of more than 10,000 patients. 2. A review of thousands of scientific papers. 3. Collaboration with many of the physicians at the forefront of functional medicine and science. The quizzes will help you identify where you are out of balance and guide you to restoring balance in each of those systems. Everyone who has diabetes will go on the basic foundational blood sugar solution diet and lifestyle program as outlined in Part 4. However, depending on the answers you give in the quizzes in Part 2, you may need to add a few extra self-care steps to personalize the program. You will do this in week 6. If you do, follow the recommended personalization of your plan in Part 4. For the majority of you, the blood sugar solution and a little self-care will solve your problems. You will be able to accomplish these steps on your own or with others through the online support program and guidelines for creating social support that is detailed in Part 4. You can learn more about our online community and access a set of free tools to help you through the program, including an online version of all the quizzes in Part 2, at www.bloodsugarsolution.com. A few of you may score in the medical care range on the quizzes. In this case, you should complete the blood sugar solution basic and self-care program starting in week 6. Then retake the quizzes after another 6 weeks on the self-care plan. If your score still indicates medical care or you don't see the improvement you'd like, it may mean you have deeper problems that require more diagnostic testing and medical treatment. In this case, I have provided a detailed online companion guide called How to Work with Your Doctor to Get What You Need. This guide, which you will find at www.bloodsugarsolution.com, outlines information on how to get the special laboratory tests needed to confirm or investigate suspected imbalances and guidelines for correcting these imbalances. I have also provided resources for you to find a doctor who is aware of or experienced in functional medicine and can be your partner in health at www.bloodsugarsolution.com. I strongly encourage you to visit the website now and take advantage of all the information, tools, and community support available as you start on your journey to healing. Now let's explore the 7 key biological systems at the root of diabetes, starting with nutrition. Page 72.